Have you ever felt that nagging pain in your shoulder that just won't go away, leaving you frustrated and wondering what's really going on? Frozen shoulder, also known as adhesive capsulitis, is a condition that affects millions of people worldwide, and it's a real pain in the neck, or should I say, a real pain in the shoulder. It's a complex condition that can severely impact daily life and mobility, making even the simplest tasks a struggle. For instance, getting dressed, lifting groceries, or even just sleeping can become a daunting task. The good news is that with the right understanding and treatment, it's possible to overcome frozen shoulder and regain full mobility and comfort. But before we dive into the details, let's take a step back and understand what frozen shoulder really is and how it affects our lives. Frozen shoulder is a chronic condition that causes stiffness, pain, and limited range of motion in the shoulder joint. It's like having a permanent kink in your neck that you can't seem to shake off, and it can be really frustrating. But don't worry, we're going to break it down and explore everything you need to know about frozen shoulder. Pain is a major symptom of frozen shoulder, and it's not just a minor ache. It can be excruciating, making it difficult to perform even the simplest tasks. Imagine trying to lift a cup of coffee or reach for a book on a high shelf. It's like trying to move a mountain. The pain can be so severe that it wakes you up at night, making it impossible to get a good night's sleep. The pain can also be accompanied by stiffness, which can make it difficult to move your shoulder or arm. It's like trying to move a rusty gate. It's stiff, it's sore, and it's just plain annoying. The worst part is that the stiffness can be so severe that it affects your daily activities, making you feel like you're stuck in a rut. Not only does frozen shoulder affect your physical mobility, but it can also take a toll on your emotional well-being. The constant pain and stiffness can lead to feelings of frustration, anxiety, and even depression. It's like being trapped in a cycle of pain and discomfort, and it can be really overwhelming. The emotional impact of frozen shoulder should not be underestimated. Imagine feeling like you're losing control over your body, like you're stuck in a never-ending cycle of pain and stiffness. It can be really scary, and it can make you feel like you're all alone. But here's the thing, you're not alone. Millions of people around the world are struggling with frozen shoulder, and there is hope. With the right treatment and support, it's possible to overcome frozen shoulder and regain full mobility and comfort. So, what causes frozen shoulder? Is it just a matter of bad luck, or is there something more to it? Well, the truth is that frozen shoulder is a complex condition with multiple causes. It can be caused by underlying medical conditions, such as diabetes, thyroid disorders, or heart disease. Lifestyle factors also play a significant role in the development of frozen shoulder. For instance, people who are overweight or obese are more likely to develop frozen shoulder due to the increased strain on their joints. Additionally, people who have poor posture or engage in repetitive activities that involve heavy lifting or bending are also at risk. Frozen shoulder can also be caused by trauma or injury to the shoulder joint. This can include falls, car accidents, or sports injuries that affect the shoulder joint. In some cases, frozen shoulder can even be caused by certain medical procedures, such as surgery or injections. The symptoms of frozen shoulder can vary from person to person, but they typically include pain, stiffness, and limited range of motion in the shoulder joint. The pain can be severe, and it can make it difficult to perform even the simplest tasks. In some cases, frozen shoulder can also cause numbness or tingling in the arm or hand. This is usually due to compression of the nerves in the shoulder joint, which can cause numbness or tingling sensations. The diagnosis of frozen shoulder typically involves a combination of physical examinations, imaging tests, and medical history. A doctor will typically perform a physical examination to assess the range of motion in the shoulder joint, as well as the level of pain and stiffness. Imaging tests, such as X-rays or MRI scans, may also be used to rule out other conditions that may be causing the symptoms. Additionally, a doctor may also review the patient's medical history to identify any underlying medical conditions that may be contributing to the development of frozen shoulder. Early detection is key when it comes to treating frozen shoulder. The earlier the condition is diagnosed, the sooner treatment can begin, and the better the chances of recovery. In some cases, frozen shoulder can be treated with physical therapy, exercise, and pain management. In other cases, surgery may be necessary to repair any damage to the shoulder joint. The good news is that with the right treatment, it's possible to overcome frozen shoulder and regain full mobility and comfort. So, what's the takeaway from all this? Frozen shoulder is a complex condition that requires a comprehensive understanding of its causes, symptoms, and treatment options. By being aware of the risks and taking proactive steps to prevent frozen shoulder, we can reduce the impact it has on our daily lives. And if you're already experiencing symptoms of frozen shoulder, don't hesitate to seek help. With the right treatment and support, it's possible to overcome frozen shoulder and regain full mobility and comfort. Thanks for watching, and we'd love to hear from you in the comments below. Have you experienced frozen shoulder or know someone who has? What was your experience like, and what do you wish you knew sooner? Let us know in the comments, and don't forget to check out our other videos on related topics.